Good morning.
I'd like to first thank Jeff for the opportunity to speak to you. As you can see, I'm an academic, which means I'm a full-time university-based surgeon. My specialty is head and neck surgery, which basically means that I spend my days separating people's heads from their tumors and then rebuilding them afterwards. And in a traditional sense, that is teaching tomorrow's medical students, doctors, residents, fellows, how to do both things, reconstructive microsurgery and head and neck cancer surgery. We also do clinical research that's aimed at preventing and better treating these problems. As such, I've got to start out with a disclaimer, and that is that I'm not representing NYU today. These are my own positions and thoughts about my area of expertise. And as such, this will be a bit of a visual departure for some of you. There's going to be graphic violence. It's directed at tumors, however. There's not going to be blood involved, really, but if you have difficulty with that sort of thing, you might look away. There's only really 3 vignettes where that is applicable in the talk. There'll be talks about sexual themes such as oral sex. You'll see a little bit of nudity, and talk about your organ, your largest organ, which is your skin. So this is, again, what we have to do sometimes to help somebody not suffer or be felled by a head and neck cancer. And as you can imagine, my office is not the one that you want to come into if you're in New York. It's not a last resort, but it is one to be avoided if you can. And there are ways to avoid it, and that's why I want to speak about using non-traditional social media in particular to try to get a message out to help keep you hopefully out of my office and the people that you love. And that operation that occurred, as you may have briefly seen, again, involves bones and brains and things that are missing. This is a nose and a mouth that are all communicated, that white patches on the skull base and the brain. And through the miracles of microsurgery, we actually transplant some of the patient's tissues to replace that so that they can wake up and go on with some degree of function and aesthetics, but you can imagine that they're going to speak very differently and look very differently. And we're using sutures that are of this order to then transplant tissue from the belly to repair that defect. So in 1986, when I graduated from medical school at the University of Florida, Al Gore had not yet invented the internet. There weren't PCs. We didn't have social media at all, of course. And so I went on to, a week after that, to Silicon Valley, where I trained at Stanford. And who would have known what the company a few miles away named Apple would create over the next few decades. Similarly, continuing on in learning how to appropriately treat head and neck cancer in particular, and the radicality involved in that in subsequent years. I never would have thought that 20 years after that, I'd be writing, and I don't know if you can read this, and so I'll briefly review it. And I said, I never expected to become a surgical Dr. Ruth this far from urology or gynecology, but my, how times have changed. And I go on to talk about, over my period of training and experience, how we now have to question the radicality of what we do based on what we now know about the HPV virus and how it's transmitted, for example. And you really would have had to have been brain dead over the past 2 weeks to have missed what Michael Douglas brought forward, either intentionally or unintentionally, and all the buzz that followed that. And for some of you, that may have been new information. But the fact is that many of us have been talking about it for years. This is from, I think, 2011, if we can find the date. And again, it was said to be new then. That makes it certainly not new now, and it wasn't new in 2011. We do get new information every day about HPV, but again, unfortunately, most of you missed this, and it's also unfortunate that it takes Rihanna to actually grab eyes to even get the magazine into hands. And while circulation of that particular publication is great, numerically, the impact value and the reach that it had and the number of lives that it might have changed, I think, is lost largely. Similarly, again, this sells the magazine, and a lot of what the content holds, fortunately and unfortunately, I never thought, again, I'd end up next to a condom package ever as a surgeon. But again, that's content that is now lost, basically. Sorry about the formatting here, but some of the themes then that I've chosen to approach in social media through a bigger audience and a different audience, really centers on behavior modification, sun protection to avoid malignant melanoma, which is largely preventable. It's an epidemic now, one of the largest killers of women between 20 and 40 now. Photoaging effects, talking about oral sex and HPV, and there's some good news in that. Moderating our alcohol intake, smoking cessation. It's a very difficult topic to keep clubbing people with, but it's so easy not to say and not to deal with that somebody's got to do it. And then using some of the celebrity examples, Roger Ebert and Adam Yauch, who just died this year from salivary gland cancer. Sofia Vergara is a thyroid cancer survivor, and you might not otherwise know that, all things that we deal with in head and neck cancer. And then announcing screenings and educational opportunities that are local. And we lost that last one. So maybe Van Gogh, in this painting from 1886, had a premonition about what the impact of tobacco might be decades later. And again, the difficulty in talking about smoking cessation and trying to make it something that grabs eyes and yet gets a message across are very challenging, but easier to do in social media venues. This is what Hollywood wants us to think about in terms of health and beauty, and indoors and outdoors, wintertime, summertime, men and women. This is one of the difficult parts, maybe for you to see. I'll go back. This is what malignant melanoma looks like when it comes to my office. This is someone who is in her 30s. She's a young mother. She's at the peak of her family responsibilities and social capabilities and professional capabilities. And you can see these are scars. We're going to have to excise skin, bones. This is what a lung looks like, blood vessels going out to the arm. Again, no real blood, so I hope you can tolerate that, but that's the end point of treating malignant melanoma. We transplant the tissue from her belly, rebuild her chest. She gets a tummy tuck in the deal and is able to survive that and smile and look better. But I'll tell you that the following year, she found herself making a videotape saying goodbye to her young children because she would not be at their preschool and kindergarten graduations. She died later the following year. Talk about oral sex. Again, something that I never thought I would have to deal with as a surgeon. You know, I cut things, I remove things, and yet we're talking about preventive medicine, if you will, and the lessons from the past week with Michael Douglas and others. The good news is, don't stop. You don't have to. It's not a bad thing, and most people enjoy it. What you do need to think about is this. How many are 26 or younger out here, or have brothers or sisters who are, or children who are? How many have been vaccinated against the HPV virus? All three? Barely anyone. Yeah. If we can get a fraction of people to do that as a result of putting this information out, then we've been successful via social media, and if we can get this information to people who are making decisions for families and children, then we've actually impacted something. So notice this. 51 years old is way too young to look at having a complete removal of your tongue. And this is something I did 13 years ago. We don't have to do this much anymore. We can do less, but we can cut the jawbone, open it like a book, go to the back of your tongue. This is depicting a tonsil cancer. This is it in real life. I'm going to go back one. Again, this person's missing a lot of parts. We're going to put them back together. And the jawbone is here and here, and we're going to plate it back together. This is the tongue made out of the belly, fat, skin, muscle. That's the belly. That's the new tongue. You probably can't see the hair on it, but he had hair on his belly, so he's got it on his new tongue. But you could pass him on the street, and he'd otherwise appear normal to you. So success, as I have measured it, is not really, in contrary to other things, not the number of likes that you might have on Facebook. It's not whether you like the pins that I put up or pin my pictures where I put incision and scars on Pinterest. It's not whether we're linked in or linked out, and it's not the number of tweets that I might have. But I ask you to give me some love because this is a difficult message to put out, and it doesn't necessarily always land on the right ears or eyes. But I think it's relevant, at least, to preventing some things that we have control over. So if we can cause the teenager not to light up, or to think twice about doing it, or to light up less, if we can think about sunscreen or a hat or a cover or whatnot, if we can think about taking our child, our cousin, whatever, or influencing people who are making those decisions to complete the vaccinations, and this is particularly for young boys, it's just been approved in recent years, then perhaps we can write the history of a future where head and neck cancer, at least, isn't the answer. Thank you.
Wow.